Hello and welcome to Health 2.0 in Las Vegas. My name is Lee. Would you kindly introduce yourself and tell us about who you are and about your business?
I'm Dr. DeShawn Taylor. I am a board certified obstetrician gynecologist, and I am the founder and CEO of Desert Star Family Planning in Phoenix, Arizona.
Thank you so much for being here. And would you tell us a little bit more about your business and also anything else you wish to add about your business and anything else you do in the community? We talked a little bit earlier. I'd love to hear some more.
All right, yeah. So I founded Desert Star Family Planning in 2013. I, over 21 years of providing reproductive health care, I started to develop this idea about how I wanted people to feel and be treated when they presented for such intimate care that people get when they go to their gynecologist. And so ultimately, I founded my clinic in an ethnically diverse, lower socioeconomic, medically underserved community in Phoenix. It's strongly in alignment with my values. I want people who have been traditionally marginalized and not quite cared for in a culturally appropriate, in excellent manner to get that care they deserve. And so my clinic provides woman care, sexual health care for men and women, all reversible methods of contraception. I provide gender-affirming hormone therapy, and we're also a hub for training of medical students, nurse practitioner students, medical assistants. And so it's just a kind of a well-rounded, safe space for care and for learning.
Oh, wow. That's very impressive. Thank you for all that you do, and congratulations, almost 10 years. That's amazing. Now, you are here being recognized at the Health 2.0 conference as an award recipient for such a prestigious award on outstanding leadership. Congratulations. Tell us, how does that make you feel?
It's always nice to receive platitudes when you're working hard, but I will say that a lot of my motivation is internal. I just have this really strong sense of justice and how people should be treated. And it's nice to have my own practice and not have to go through bureaucracy or worry about hospitals and boards. Like when I see a need in the community, then I'm nimble enough to be able to figure out how to do it and do it. And so, but it's definitely nice to be able to be among other leaders, outstanding people who are also doing great things in healthcare. And so coming to receive that recognition comes along with that, privilege to be able to network with other great people.
Great. And what advice would you give to those wanting to follow in your footsteps?
Now that's a loaded question. There's not a lot of people of color, specifically Black people in medicine. Black women make up just over 2% of all physicians in the United States.
2%?
And so I don't know what that number is for OBGYN,
wow.
But so many women of color come to see me because I'm a woman of color. And so there's so many more of us needed. So definitely these days, healthcare, especially becoming a physician, isn't sexy as it used to be, but we're still needed. We're so needed. So definitely if people have some type of inspiration or desire to go into medicine, don't count out being a physician. It's worth it.
Well, you definitely make it look good, I must say. Tell us, how has Education 2.0 been so far? You've been able to network and collaborate with other professionals?
Yeah, so what's been great, the way this was set up, is that we had our own sessions for Health 2.0, but then we also had collaborative spaces with the other conference attendees.
Other segments.
And so it was awesome to be able to do some cross pollination of ideas. I mean, some great people who were at the education conference, great people who were at the marketing conference. And so those are going to be like really great connections because we're all interconnected, right?
Yep.
As a physician now in private practice, I would have never thought how much I needed to learn how to market myself. I have multiple social media platforms now, a blog, all kinds of things. And in medical school, they just go take care of the patient. But then you learn that you need to have all of these other different tools so that people know who you are and know that you're there to help them. So.
Yes, and especially now as we're evolving more into telehealth. So that is definitely crucial. So tell us, how can we find you online? Where can others go to further collaborate with you?
So I have a few different things. So first of all, I'm here as founder and CEO of my clinic, Desert Star Family Planning. So you can find us at Desert Star Family Planning on Instagram, also Desert Star Family Planning on Facebook. And mentioned that I have a blog, and so I do have a book coming out that I wrote this year called Undue Burden, a Black woman physician, Christian, and pro-abortion and the reproductive justice movement, that will be published in April. And so if you go to healthjusticemd.net, you can sign up to find out when that book's going to be published, or you can buy it. It's going to be awesome. And I also have a blog related to the book on that site.
Well, that's so exciting. I'm so happy for you. Looking forward to 2023 and your book. So thank you for taking the time to speak with me today. It's been an absolute pleasure and honor. Congratulations on receiving your award. I hope you enjoy the rest of the conference. I hope to see you again soon, and enjoy Vegas.
Thank you so much.
Thank you.